Welcome, everyone. We will start the webinar in just 1 minute. Thank you. Hello, everyone, and welcome again this afternoon for a very exciting discussion with three of our most choice physicians in the Healthcare Executive Group. I'm Ferris Taylor, Executive Director of the Healthcare Executive Group, and we thank you for joining this live and interactive physician Q&A. We'll be talking about COVID-19 and where it's taking us. This is an extension of our HCG Virtual Thought Leadership webinar series, and COVID continues to be an important topic in healthcare at the moment. Since late February, we've struggled with the crisis, worldwide pandemic, emotional, physical, financial, major healthcare disruptions. We're dealing with shortages of testing supplies and medical equipment, personal protective equipment that we've talked about several times. We've adopted virtual care. We still don't have a fix on the uncertainties, financial and otherwise, with respect to COVID. And for many, the mindset, whether it's leadership in healthcare or consumers, have changed in a number of ways. And on top of that, schools and businesses are struggling to safely reopen and bring some semblance back to normality in our work and our communities and our families and like that. So from the podcast that we shared a few weeks ago on the impacts of COVID heading into the fall, we received a number of comments and questions. And we will address some of those with our panel of physicians here today. So let me introduce them. And if I can get my slides to advance here. There we go. First, we have with us, getting on shortly, Dr. David DiLoretto, a longtime HCG board member and a board certified ophthalmologist and ophthalmic plastic surgeon. He is currently a principal at Vizient, the SG2 part of Vizient, and prior to that was Senior Vice President of GE Healthcare. So we will welcome the conversations with David. We also have Dr. Johanna Vidal-Phelan, who's Senior Medical Director in Pediatrics at the University of Pittsburgh Medical Center, UPMC, and a practicing pediatrician at the Hamilton Health Center, an FQC in Harrisonburg, Pennsylvania. Thank you, Johanna, for joining us.
Thank you.
And we have Dr. Jason Wu, a practicing board certified obstetrician and gynecologist, and a veteran with 31 years in the Commissioned Officers Corps of the U.S. Public Health Service. Lots of deep experience there. Dr. Wu is also a consultant with the Arbinger Institute, and he always challenges our thinking. So all three of these physicians are considered premier HCG physician thought leaders. Our goal today is to review the issues and open up an interactive discussion to provide additional insights on what is changing and what remains the same with COVID, especially going into the fall and winter of and going into 2021. As a note, you can still submit questions if you haven't submitted them in advance of the webinar, comments or requests for additional information by using the Q&A function in your control box. And we will highlight where we are at in responding to COVID throughout this session. So to start off with, Here's an abbreviated list that you see on your screen if you're online of the topics we have covered since first talking about physician perspectives on COVID and its impact for the fall. And to start us out, for each of you, and just take a minute so we can get your voice associated with your name. Any thoughts you have or things that have changed since our previous discussion, or what stands out in your mind as growing importance in the COVID crisis. And perhaps, Johanna, I can't see if Dr. DiLoretto is on. Let me know, David, if you are.
Hey, good afternoon, Ferris. I am. Unfortunately, I can't share my webcam right now, but I am pleased to be with you this afternoon.
Well, why don't you start us off, and then we'll go to Johanna and to Jason with respect to any further thoughts on this list. And we'll go into each of these topics for a few minutes before we open up to broad Q&A. But David?
Well, you know, I think one of the topics that's coming to mind now is really, how do we avoid something like this happening in the future? You know, it's very light. For 20 years, we've known that there was a potential for global pandemics. You know, part of that is simply the fact that the world is more interconnected. There has been deforestation, and animals and humans are closer together. And you know, the estimates are there's probably about 500,000 animal viruses today that would have the ability to actually jump species. And so how do we think about preventing something like this from happening in the future? Obviously, it's going to be rethinking preparations. In this pandemic, it was very clear that even though we've been talking about this for decades, the potential for it happening, you know, China had a hard time containing the virus. The WHO was outflanked very quickly by it. The United States was not prepared for testing. You know, New York City and northern Italy did not close down fast enough. So there were a lot of issues that really need to be addressed forward. So giving some thought to how do we look at prevention of pandemics, much like we look at national defense, in being prepared all the time is something that probably is worth discussing.
Wow, I can't wait to get back to that topic. Jason, what jumps out to you in the last few weeks with respect to COVID?
Thanks, Ferris, and it's great to be here. Yeah, you know, I think the thoughts around what's happening with vaccines is probably beginning to creep in, because I think early on folks were, you know, medicine, there's a tendency to look for the magic bullet, and I think there was a lot of hope that a vaccine would be a magic bullet, but I think most folks are beginning to realize that there's just so much uncertainty that comes with that even when those begin to become available, we really need to sort of think a little bit longer term about what the next normal is, what the new normal will be, even when those are available, because they're not going to be a silver. There's always hope, but as an old mentor used to say, hope is not a strategy.
That is true. Johanna, how are you doing with this overwhelming list?
Well, you know, thank you again, Ferris and ACEG, for having me as part of this panel. I definitely appreciate the opportunity to share my thoughts. A couple of things come to mind. A lot of innovation and the use of telehealth, and how COVID-19 pandemic has really made me, particularly as a pediatrician, think outside of the box and implement and practice telemedicine, and really how to utilize innovation to reach our members, to reach our patients, and to continue delivering a message of wellness through a pandemic. The issues of, as a pediatrician, of going back to school and children care, and how does it impact in families and well-being, not only of my pediatric patients and members, but also of the families, is really important. And preservation of, you know, preventive care, well, child visits, immunizations in the pediatric population is really important. And how do we break those barriers that you may see because of the pandemic, and also issues of health disparities. The COVID-19 pandemic has brought forth a lot of these issues into the forefront, and we need to discuss them, we need to address them, and they're very important and very impactful to many of my families.
Fantastic. I look forward to hearing how you're balancing an executive, a family, a commute to practice on Fridays, all of that. So let's dig deeper into each of these to set up the Q&A, and we'll monitor the questions that are coming in. I see a few, so keep them coming. You know, let's take what you teed up just a little bit, Jason, in terms of how long and how will we deal with COVID-19. You mentioned several of the aspects here. Kick off the discussion, and then let's have Johanna and David weigh in on this one topic to begin with as well.
Yeah, I think one of the challenges from the beginning is that there's been a tendency to be a little bit more, again, not to blame, a little bit more short-sighted in terms of our time frame, in generally responding to COVID-19. I think folks were initially hopefully okay, and by the end of the spring, maybe things will be better, and then by the end of the summer, we'll have a better handle on it. And I think that, you know, that hope is not a strategy concept, is that there's always been, okay, it may just go away, or we'll have a better understanding of things. I think what we're beginning to see is people are recognizing that this is a long haul. That, you know, that yes, some of the breakdowns in our public health system and in our responsibilities have not set up us well in terms of being able to get a quick handle on this. And so with that, I think it becomes more important to think about the long term, and then how we are in relation to one another, and thinking about this, how we're going to come out together and what we can do communally. Because unfortunately, I think science has been very helpful in medicine providing cures in the past. But for a pandemic, that doesn't happen overnight. You know, for be it the testing, you know, as we've seen the variety of different tests available and whether or not how accurate they are. And even in the news, you know, so relevant today is the president, you know, had a rapid test that was negative, and automatically the concerns that, well, how valid is that, right? So there's just so much data that we don't know around this that it's going to take time to accumulate and get a better feel, and then begin to standardize, because typically, you know, the CDC and the FDA, the organizations I used to work with, and had experience in responding with, you know, we typically have a longer time frame or better preparation for being able to provide good information. And unfortunately, in the current environment, we're just, the need for, or the wish, I think, for a silver bullet is getting in the way of us being more deliberate about what type of data and information we'll have in the long term, and particularly around the vaccines. And I see Joanna, you know, nodding her head along, because, you know, I think there was so much rush. Oh, we've got to get a vaccine out there, and recognizing that, you know, in this short a time frame, one vaccine is not going to be enough, right? It's not going to tell us enough, and it's going to take many months after that before folks even, you know, will be able to understand the effectiveness. But then even after that comes the question of uptake and immunizations, and how long that will be take. So I think I begin to see some more you know, reports that folks are beginning to plan a little bit longer, not just January, but really, you know, July, August, September is. I mean, actually, David mentioned that in one of our other conversations, how it's really not until next summer, or towards the end of next summer, that we'll be getting through this initial COVID-19.
David, building on that, has your timeline changed in terms of long and how?
You know, the uncertainty about the timeline, you know, creates a lot of volatility for folks. But I do think that the realization is setting in that there is not a magic bullet that, you know, as it was explained, this will be, you know, a combination of having to develop and deploy effective vaccines. Therapeutics are going to be extraordinarily important, and actually are very promising. I think if I think back over the last 6 months in the sphere of therapeutics, there are some things that happened that I think are going to help us in the future. One is that it was an amazing rapid development of vaccine research very, very quickly. You know, the ability to develop a monoclonal antibody that is looking very promising at this point in time, you know, was put in place very early on back in March. And so those are encouraging signs. We know more about who to protect. And so, the epidemiology is sorting out. It'll be very clear that this virus is going to be with us. It's very likely that it could become a seasonal respiratory virus along with others. But the economic impacts will probably stretch into this time next year. There'll be obviously regional surges that are already occurring, but the good news there is the health system isn't being overwhelmed, and that was obviously the reason to have to shut down economies in the spring. And so even though there are significant resurgences occurring, the health systems are getting much better about capacity management and the ability to deal with it. So it will be with us. There's no magic bullets, but I think we're getting smarter every day. With respect to the science, it's interesting. Folks are learning a lot about science, right? We actually ask, we tolerate and even encourage scientists to challenge each other. So it shouldn't be disconcerting that there are different views on how to suppress this virus. That's how science actually advances. And unfortunately, when something gets politicized, when science gets politicized and politicians are trying to develop consensus, often that can be confusing for folks. But I think the history will show that science responded pretty quickly in 2020. And it'll just take a while for the history to sort that out.
Johanna, what are you seeing on the front line?
I think in the front line, I really encourage my families to ask questions about vaccines in general. It's really important, especially in pediatrics. But I get that question a lot, what do you think about the COVID-19 vaccine and is it safe? And I believe in the importance of practicing evidence-based medicine. And so I am the one that's reading the articles and reading the studies and kind of, to make a recommendation. So I think it's too early. I know that people are having these conversations, which I really welcome, because I want my patients to be immunized against all the other things that we have vaccines preventable conditions available to. And I think that one of the challenges that we'll be having through the COVID-19 pandemic has been a decrease in the number of well-child visits and immunizations in pediatric patients. So I love having these discussions. I think as preparation for the fall and the winter and whatever may happen with COVID-19, we know that we are in the long haul for this. This is not going to be a solution that we're going to have a vaccine and everything's going to go away by November. But we do want to have these discussions, and I want parents and families to be curious, to be up to date, and also to be realistic of what they can do today. I don't want them to be worrying about a vaccine that is not available, but focus on the things that they can do today, which is, teach children and their family members to use a mask correctly, wash hands, social distancing, and preventive measures that are really important, and that's what's actually impacting COVID-19 curve.
And you've been such a strong voice, Johanna, around that simple message, just the 3 or 4 things that we need to do that not only relate to COVID, but to flu and to lots of other things. Before we move off this time frame, there's a question come in: has reopening schools and businesses complicated the expectations for COVID? Another one is, are we in the second wave, the second surge? Are we just still dealing with the first one and the second one is coming? Any quick thoughts from any of the 3 of you on those questions?
Well, first, before we jump into that, I just wanted, both David and Johanna brought up some very good points. One, I think, which are reasons for optimism moving forward. Partly, as David pointed out, our healthcare system is not being overrun. And that makes a big difference to me, I think, in terms of how we see the potential getting infected, right? Because I think it begins to say, okay, if I do get infected and I get sick, then at least the system is there to support me best that it can. Whereas, early on in the epidemic, there wasn't certainty that would be available. I know there are parts of the country that are still a little bit stressed, that were later to get exposed, have their exposure rates go up. But for the most part, certainly in the major metropolitan areas, the systems are not being overwhelmed. And so then that leads to what Johanna, I think, pointed out, is that given that we know that the care is available if we get sick, that gives us more control about what we choose to take on, right? What we can do ourselves to help prevent the risk based on, what we feel our individual situations are. So if there are families that need to get back to school or get back to work, or folks that need to go back out into and engage with others, they can do that with a little bit more comfort, knowing that if they do get, not to say that they should get infected or try to get infected, but that if that happens, that there's the healthcare system is available. And I think that provides a little bit more stability, at least moving forward, in terms of how we look at the long term of this. Whether or not it's the first wave or the second wave, I think there are probably some parts of the country that are looking at potential second waves, but I think to me, it still looks like it's still our response to the first wave.
David?
Yeah, I think that, with respect to schools and businesses reopening, the other learning here was that there are significant trade-offs to shutting down schools and shutting down commerce, and the health implications of that became fairly clear. And so obviously the education system and its responsiveness to educate children is going to be very important. And so the ability to manage the pandemic without shutting down large aspects of society, hopefully is something we're getting better at as well.
Critical point. Johanna, I think I cut you off.
No problem. I just wanted to say that, knowing that the health system are not overwhelmed, we also have to have a community approach to that, and meaning that we're all responsible to keep it that way. And our behaviors will impact the situation with our local hospital systems, and that is really important. And I also wanted to mention, as physicians in the forefront, this has been ongoing since March, and this has been a very stressful situation for many physicians and providers out in the field. And so I think the message that I keep hearing over and over again from my peers is cooperation, follow the clinical guidelines. Please don't make a risky situation where you can allow yourself to get sick. If there's anything that you can prevent, do so, and be careful, because we want our children to be in school. No, we want to have an open economy. We want to be able to enjoy life, and it all depends on our behavior and our how we protect ourselves and our families.
Terrific. And David, I know Vizient works with several thousand organizations around the world, healthcare entities and like that. So what have you seen across those organizations in terms of strategic sourcing of personal protection equipment and other medical supplies? And what do you think is ahead there? Are we better prepared for a long tail on the first surge, or a second wave of COVID?
Well, it was very clear that in the preparedness for pandemics, the global supply chains of key healthcare products was not adequate and failed. And so it comes back to this notion of preparedness, much like we do with national defense. And so one of the undertakings of Vizient was participating with FEMA and the federal government in creating the Life Bridge that began to relook at global sourcing. Our company actually invested in companies with its own capital to develop onshoring capabilities for developing PPE equipment in the United States, something that largely had been outsourced to other countries. And so I certainly in healthcare, there's much more work to do now to look at national supplies and how they're secured. And my own thinking is it'll become much more like national defense in order to not just be prepared for an ongoing COVID-19 pandemic, but actually looking throughout the rest of the 21st century to be prepared for early detection and response to pandemics. And that includes rethinking supply chains, not just in healthcare, but in many industries. Folks now are viewing their supply chains as key strategic initiatives and rethinking, creating new redundancies and capabilities in the event that those supply chains should be disrupted. So still much more work to do there, and probably even rethinking from a strategic standpoint the importance of these supply chains.
Go ahead, please.
Yeah, this is Jason. So, yeah, David brings up a really good point, and I think in the public health service and certainly in the defense, we've looked at global pandemics as being a national security issue for a long time. But I also think that speaks to one of the challenges in dealing with pandemics is to think of it within a mindset of a national defense strategy. Absolutely, we want to be proactive, but it's also it can be hindering in the way we collaborate internationally around this, right? And I'm not going to Pollyannish and say that we're going to solve the international diplomacy issues, in a wink, just because there's a common challenge around disease. But it speaks to how different a relationship between the United States and China might have been, might have affected the availability of information or the ability to interact early on in this. If we hunker down and begin to think, mostly focus, and I'm not suggesting David's saying this, but if we focus on simply protecting ourselves from the next pandemic, I don't think that's going to be as effective as thinking about how do we build that global community and see more of our interdependence, and how we will have less disruption and disturbance when we're more collaborative up front and do focus more on how do we build that trust.
Yeah, you're exactly right. And here, I think there are some promising opportunities. And it really is using surveillance techniques in the future that allow early detection. So for instance, the ability to use machine learning to look for atypical patterns in lung scans early on that would suggest unusual infections, or to sample water on a regular basis looking for unusual genomic compositions in wastewater, could be early surveillance techniques that could be done in a collaborative fashion and avoid the circumstances that we had in this pandemic, where it wasn't clear what was going on and the ability to contain the virus was inadequate, and the virus was probably circulating globally much earlier on than we all realized.
Johanna, you mentioned the vaccines and testing, and I especially appreciate your perspective because you're dealing every week with patients in your clinics. Is COVID impacting some of your patients more than others? Why? What's the additional dimensions that our HCG executives should be paying attention to around vaccines and testing and that topic?
Thank you so much, Perry. That's an excellent question. And I think at the beginning of the pandemic, one of the issues that we still struggle with is to have data. And the reason I bring that up is because one of the issues that we have and we know from a national perspective now is that COVID-19 has impacted minority populations disproportionately compared to others. And we didn't know that at the beginning of the pandemic. I know it's a new virus, but also even if we wanted to look at data and find out more information about these demographics and racial and ethnic disparities, it was really challenging because we just don't collect data like that. And so it brought to the forefront the importance of looking at information with a different pair of lenses. In regards to COVID-19 and the vaccines and how does it impact my patients, I honestly have allowed me and given me an opportunity to discuss influenza immunization with families that in the past have been very resistant to have that conversation. There's a lot of myth out there about the flu vaccine. A lot of people, I hear it, oh, you get sick from the flu vaccine. I'm always healthy. I don't need it. There's no reason for my children to have it if they're fine and they have no problems. And so those beliefs have come in along, and I can see people asking more questions about the flu. And because of COVID-19, explaining and educating to families and children that, when you have COVID-19, your symptoms are very similar to the flu. So there's no way for me as a physician to tell over the phone or just looking at you, oh yeah, you got the flu, or yeah, you have COVID. I will have to test you. So I have to do now 2 different tests, one for COVID, one for flu. And that is a concern about the situation in the fall and the winter, because if now we're all seeking care for COVID-19 and the flu, then we're going to have a situation where emergency rooms could be overwhelmed and hospitals could be overwhelmed in the winter months. And it can be avoided. I also explained to families about the flu vaccine. You can still get the flu, but what the flu does, the vaccine does, is protect you against the complications. So every year in the United States, almost 200 children die of flu, and 80 to 90% of those children did not receive the flu shot. And so we really want to do have a message of prevention. And this is what's allowing that COVID-19 and parents asking questions and us doing education to hopefully increase immunization rates, not only for the flu, for all the other preventable conditions.
And Joanna, I'm wondering your thoughts around educating folks around herd immunity, right? Because I think in my career, I often was trying to convince young healthy people on why, are you not even young, older healthy people about what the benefits of getting the vaccine, flu vaccine, and helping them understand it's not just necessary about them, it's really about protecting those around them, right? And is this an opportunity to help educate folks around that?
Absolutely. Perfect example, a newborn up to age 6 months cannot get the flu vaccine. So you have a 6-month-old baby, and we're counting on herd immunity to protect that baby, what we call the cocoon effect. So we're asking the family, the grandparents, the siblings to get the flu shot so that this baby is protected, especially at such a vulnerable age that can get complications if they get the flu. I think I talk a lot about herd immunity at the teenager visits when we have the 16-year-old and they need to get their meningitis shots, and they're like, why do I need to get a shot? So kind of the education about, when you go to college and you want to be protected against meningitis and the different strains. And so I think that there's also value in, you're educating the parents when the kids are young, but now you're engaging the young teenager and really engaging them in understanding the value of preventive care and why they should get their shots themselves, and the importance of this, and what is herd immunity. And I think children are, as adult, as they grow up, they're starting to understand these concepts and actually be more involved in the decision making if they want to get this immunization or not. And really, I talk to my 16-year-olds directly, and of course with consent of parents, but I need them to understand why you're getting this immunization, why is it important to you, and how does this contribute to society well-being.
Terrific. And as questions are still coming in, let us process those. But I thought here sort of midway through, I would give you a little background on HCG. We're a national network of executives and industry thought leaders celebrating our 32nd year, working together to improve and reshape healthcare by guiding healthcare executives through innovation, change, and growth. And as several of you have mentioned, and one of our board members on a board call said, don't waste a good crisis. COVID has definitely accelerated innovation and change and growth. We interact regularly across multiple channels, such as these webinars and podcasts, research and white papers and newsletters. But by facilitating these interactions and these discussions, we provide a platform for networking and information sharing and critical issue discussion. You can always learn more at hcg.org, and including there is a link to what was called the COVID-19 Flash Survey, Industry Pulse Survey. We released Industry Pulse for 2020 in February 25th, I think, this year. And obviously, in just a couple of months, there were new priorities and new challenges that came to the top of the list. So we will reference that. Let me go to one slide from that, and you can go to the full report at bit.ly/Industry Pulse COVID-19, but shorten that to INDPULSEC19. But as you can see, and the first message that we saw here, and we've separated out payer perspectives from provider perspectives for quite some time, but and there's always been diversity or disagreement in priorities. But COVID has definitely brought the priorities to the top of the list. The 5 top priorities, with a very slight change in order, are the same for payers as providers. And this was almost 300 executives who responded. So that is really good news. I will point out, and you mentioned it, Johanna, that accessible points of care, which includes telehealth and remote monitoring and like that, was the one priority that was number 8 on the top 10 list coming into 2020. And it has moved up most significantly. Johanna, how has telehealth changed how you and how UPMC practice medicine? And what do you see as the innovations or the challenges that are there, and where telehealth will take us?
So telemedicine has been there for a while. Well, I think the challenge was adoption. And actually, believe it or not, physicians, providers, we probably were the #1 barrier, and including myself. I mean, if somebody in December of last year would have told me, Joanna, you're going to practice telemedicine next year as a pediatrician, I would like, what? And now definitely experiencing for the first time and experiencing with my patients and able to do it both in English and Spanish, it really has opened a door of opportunities. And it's almost like, why we didn't do this earlier? And our experience at UPMC has been like a remarkable adoption from our physicians and provider community in telemedicine. There is the desire to stay connected, to continue providing care, and why not use the technology that we already have available? Also, our patients and members are really happy and they want to engage with their providers one way or another. And so in the midst of the pandemic, when we couldn't leave our homes and care still needs to continue, as patients need management for asthma, for all the chronic medical conditions, it is important that we remain engaged with our physicians. And so continuing that wellness message and that contact and that care, telemedicine has provided that tool. So it's a tool, and I think that as the pandemic continues to change, and these different innovations continue to be adopted, we start thinking outside of the box. And definitely this has been a wake-up call to say, hey, there were things before that I probably was not considering, and I'm thinking, how can that actually be something that I can do now as a tool to reach to my members, to reach out to my patients? So there's definitely a lot of opportunities, and I think now physicians doing it, many of us for the first time, we are now convinced that this is a very valuable tool that we want to continue using even after a pandemic situation.
Yeah, I think it's nice that sometimes, you don't let a crisis go to waste, is that it requires agility to adapt in many ways. And I think that's created a little bit more openness towards the technology and all the things that are available to it. I mean, there's definitely more immediacy that's available now than there were 20 years ago when I started telehealth program with fixed phone lines and trying to set up video cameras. But now the potential and the fact that the consumer experience is much more immediate, right? Folks aren't willing to wait forever anymore. They want to have some of that immediacy. They want to be able to get in from wherever they are. And I think the folks who have been more adaptable, particularly on the provider side to this, are seeing a lot of success. And so that's one of the things that's one of the changes that's probably not going to go back, because I think the reimbursement models are probably going to be more open to that. And so the folks who are taking the lead in that are probably going to be, I don't want to call them winners, but definitely at the forefront of helping continue to push us in that direction.
Terrific. To shed some light on that, Jason, and perhaps you could transition us. Well, first, I wanted to share, and the white slides are all directly from the COVID research that was just published a few weeks ago. It's showing that telemedicine is here to stay for both payers and providers. And many are saying, the payers in particular are saying that reimbursements will increase even more after COVID-19. It's interesting to me that on October 1st, many payers reinstituted their telehealth co-payments and deductibles. Now, some still waive the copay for any COVID-related type of teleconsult that needs to take place. But the impact that we see with the COVID flash survey suggests that the volumes and the reimbursement is going to continue. So, Johanna, it's encouraging news that telehealth will be here. But Jason, you've also mentioned another critical impact, which is the delay of care, whether it be preventative, chronic, or other non-urgent encounters. When do you and the rest of our panel experts expect volumes to get back on track from seeing physicians? And I guess part of the question, we can share your article. I hope you just a few days ago had an article released entitled "Why Shifting Our Mindset Matters." And healthcare is one of those industries that's been resistant to change. So what do you see as the recovery for these deferred procedures?
Yeah, well, if you're asking specifically about the deferred procedures, right? Some of the interventions, I think that a lot of those can only happen in a facility, and I do see that a number of certainly in the New York area, a lot of those practices have started picking their volume back up, and in some sense they're almost back to normal because they know how to take precautions and create that environment where those can continue on. I think for me the broader question though is around individuals related to some of the preventative visits that folks should be coming in on and how frequently they're there. There's so much uncertainty, I think, in terms of the economic situation and what will be the sort of the national plan and what people's incomes will be, or whether or not they'll have insurance in 3 months, whether or not they'll have a job. That certainly, I think plays into whether or not how quickly folks will pick up those type of services. In one sense, though, I also think it's the opportunity that we can see how the costs can be shared a little bit more, because I certainly know when I was with the Indian Health Service, even though my clients were not having to pay in terms of a fee for the service, they were paying with their time, right? They would have to come and wait, for weeks or months to get availability. And I think the current environment is perhaps allowing folks to realize that their time is perhaps as important as their pocketbook. And so giving more folks the opportunity to balance those. So I think on that side, again, depending upon how the economic situation in the broader environment is around insurance and incomes, that there will be the opportunity for this to pick up, and particularly for providers to see patients more, see them where they are, right, and be more adaptive to the different types of environments that their patients are coming from.
David, Johanna, any comments on this deferred care that we've accumulated over the last 6 or 7 months?
Yeah, as was noted, a lot of services have come back to near pre-COVID utilization levels, particularly those services that cannot be deferred. It really, the continued impact is in a couple of areas where there is some elasticity of demand, some folks deferring services, perhaps unnecessarily or out of real and true concerns about infection. I think the greatest impact over the next 2 years, though, will be in care model redesign because of the introduction of virtual health. It's very clear that emergency room volumes, particularly for low acuity conditions, remain low and probably won't come back because hopefully there'll be ongoing, easier and better channels for getting services that are low acuity. And so likewise, a number of the traditional evaluation management codes that physicians would use for face-to-face services for chronic disease management, very clearly care models that integrate remote sensing and the use of virtual care are going to lessen the need for some of those face-to-face visits, and that'll be better care. That'll be folks with chronic disease getting more frequent monitoring than when they were going into a physician's office for face-to-face visits.
Excellent. And the three of you have mentioned a couple of things. I will just share, sitting back here against the mountain in Utah, that today the academic medical institution here announced that they are at 95% of their ICU capacity, and in particular, Salt Lake and Utah County are in the middle of, I mean, the numbers that we've had over the last couple of weeks have been the highest numbers yet. So they are deferring elective surgeries right at the moment so that they don't go above 95%. So this is an ongoing crisis that we're going to have to watch. But David, I think your comments are very encouraging. Let's move to another topic, which is the sort of financial economic impacts here. And you know, David, start us off with what has happened financially and economically to the stakeholders and where you think we might be headed there.
Well, obviously 2020 is not done yet, and it's from a financial standpoint been extremely difficult for providers, and we're beginning to see you know, some of the impacts play out. They were able to be buffered earlier on by federal support and subsidies, but there isn't a day that goes by now, you know, where we don't see a health system having to lay off or furlough workers. And so it's a you know, it's a sad part of the economic fallout here, but the demand destruction for many health systems was very difficult for them to overcome. It's hurt certain physician practices fairly significantly as well, and there'll be a shakeout from that. But on the other hand, we are seeing expansion of access points from, particularly in the retail space. So you see folks like Walgreens yesterday announcing their $1 billion investment in VillageMD will result in about 500 new practice locations for primary care services around the country. Walmart announcing, you know, not just the expansion plans for its clinics, but a joint venture now with a health plan as well. And so I think we'll see new and different types of access points opening up for the delivery of healthcare services. It'll mean that traditional health systems will certainly have to rethink strategies. Of likely to be another wave of consolidation in the industry as well. But a lot of what will happen is we won't be going back to inefficient care models, things that were not focused in the right place. I think hopefully a lot of that will sort itself out, but 2020 for providers will go down as one of the worst financial years they've ever experienced.
Is that what you're seeing, Johanna, with UPMC and the clinic that you're working with?
You know, I think this is an opportunity, you know, as part of the pandemic to talk about value-based care and to think about different payment arrangements and how, instead of moving from a fee-for-service model to an alternative payment models, and definitely engaging in those discussions has been very important. Our experience of UPMC has been no furlough. You know, we've been very busy providing care, both for primary care and specialty care across the state of Pennsylvania. In my personal, you know, clinic, you know, I know that during the pandemic time, the volumes were lower, but we're bouncing right back. And actually, we are calling our families, come back. You need to roll out visits, get your immunizations. And it's extremely busy time for pediatricians. I know the American Academy of Pediatrics nationally had an article come out, a report 2 weeks ago about the impact of COVID-19 in pediatric practices across the nation and the dramatic drop of well child visits and immunization visits in primary care practices, which is significant. In our local area, we haven't seen that. And actually, there has been a preservation of this well child visits and immunizations, which has been so great to see because it talks about innovation. It talks about how physicians are thinking outside of the box to engage with families. You know, one of the projects that I'm really proud about is Tele-Well-Child. So UPMC offers Tele-Well-Child services where you can engage with the family. Obviously, they need to come back for their shots. Their immunizations cannot be delivered via telemedicine, but there's a lot of key health messages that can be done, from screening for developmental screenings, nutrition assessment, and many parts parts of the well child visit can be done by telemedicine. So again, this is an opportunity to think outside of the box, think about innovation. Physicians are talking about alternative payment models and how they can engage in this kind of conversations because they have seen what the pandemic has done, and now they're more probably engaged and more curious to learn more.
Hey, Johanna, I'm wondering how UPMC has always been an innovator in this space, and to David's point about some of the mergers and acquisitions, are you seeing, or have they begun to share how they're integrating some of these additional care sites, be it their pharmacies or health clinics, to do some of that follow-on that you're talking about, whether or not it's giving a shot or picking up meds? How is UPMC engaging around that to try and take advantage of that or to provide value there?
I think alternative site of services is really important. And we want to meet the families and our patients in general where they are. And so if they are opting to get their flu immunization at a local pharmacy, that's great. We really want to be sure that they also get all the preventive messages and services. So UPMC is highly engaged in, again, developing a membership interaction, member engagement, a patient engagement, so that they know, come back to the doctors, interact with the doctors. Sometimes we have an app that families can download, make an appointment, answer questions, ask questions, look at their own labs. So making it as consumer friendly as possible. And that it takes an army. It's from the doctor to the front staff to our care manager team. We have practice-based care managers in practices that have high volume of our membership, and they are engaging with families and adult patients every day to be sure they're getting the care they need, from day one.
So we've been weaving questions in here. I have been, but to wrap up your perspectives, and I'll lob a couple of questions from the audience into this. We thought we would end with, what are the lessons that are learned, or what are the lessons that are yet to be learned? And from our earlier conversations with the three of you, there were some topics there, but we don't want you to feel constrained by that. So, as you wish. Any comments about the lessons learned, long haulers, or experience around the world? Or you had mentioned some stats on employment, especially impact on women. What are some of the lessons that are out there for us?
I would start that, having been a public health physician for the longest time, and we always, it's actually I'm blanking on the word for it. It's our theme song, our motto song. But we are the silent war against disease. And I think for too long, folks don't understand the importance of investing in public health infrastructure and continue to support those and the science behind it. We can certainly survive without a centralized, coordinated response, but it's so much more discombobulated and so much more stressful when we don't have a common language and vocabulary and approach to addressing these large challenges from certainly a national standpoint, if not a global. And so, perhaps I'm hoping, again, it's hard to tell in the political season, but I'm hoping there's more interest in investing in sort of the public health infrastructure and ensuring that those institutions that help provide us good data, good sources, good tools continue to be well supported, both at the federal and the state levels and the local communities.
Good perspective. David, I think you mentioned long haulers. For our audience, any updates there? Maybe we've lost David.
It's just too many different mute buttons today on the different systems I've been using. There is evidence that for some folks, unfortunately, the symptoms of COVID-19 infection do not clear up quickly, and that they have symptoms of fatigue, for instance, that can extend for many weeks and even months. And then there are long-term implications that we may not still understand regarding the disease. Still more to learn about not just transmissibility, but immune responses. And so from a health system standpoint, would not surprise me that a physician starting today in practice is not dealing with COVID-19 related complications a couple of decades into their career. But I want to echo what Jason just brought up, the need to rethink investments, much like we do in national defense, where we make investments annually every single year, even when there are not wars, is going to increasingly become important. It's simply not the last pandemic of the 21st century that we may encounter. And so the ability to make sure that there's collaboration, early detection, I'm encouraged by technological advances in AI and machine learning that from a surveillance standpoint could help us, much like satellites helped us during the nuclear age, to make sure that there was deterrence and early detection of national security issues. I think that's going to be needed, and hopefully policy makers are beginning to think about the types of investments that are going to be required.
Other lessons?
Paris, I want to share in 1 minute the importance of the COVID-19 pandemic in women's careers and the impact that this pandemic will have, not in 1 or 2 years, but in a decade or more. 4 times more women than men stop working or looking for jobs in September. And that's like 80% of 1.1 million workers who drop out of workforce are women. And so we can be in the sidelines saying, oh, well, this is going to get better. We have to purposely be inclusive of women in our jobs, in our teams, in our companies, and understand some of the challenges that we're all having with caregiving responsibilities, and also the need to be mindful of some of these challenges that are impacting disproportionately more women, especially in healthcare, than in other industries. So, it's happening. We're observing it very carefully, but it's an impact that we're having not only in the industry, but in academia, as this is definitely being challenging when kids are not back in school and the situation of caregivers is not, solidified specifically now for the next couple of months. So we want to be mindful of that.
Excellent, and we'll share some of the statistics, Johanna, that you had shared just last week in the follow-up information. That is frightening and counter to all of the things that we've been doing, especially in healthcare, in integrating and bringing the full perspective, especially of women and minorities, into the healthcare solutions that we have. I can tell that our time is getting short. We appreciate the questions that have come in, and sorry, I had a placeholder slide on the Q&A, but in closing, we certainly want to thank our panel for the thought and the flexibility to actually put yourself on the line and answer these questions that have been raised. And I think this, and David, you, Jason have both mentioned the national defense model as a model of what healthcare needs to learn. I had not thought about that component, but in fact, this is a war, and we know that we have the best in healthcare, and we've seen the best in healthcare coming out during this crisis. So all of us want to thank you, Dr. DiLoretto, Dr. Vidal-Phelan, and Dr. Wu, for taking the time to answer the questions around COVID-19. There are no perfect answers. I quoted Yogi Berra in a webinar last week. It's difficult to provide projections, especially about the future, and That's what we've been talking about today. We HCG anticipate that these new ideas, these topics, these discussions, perspectives will be of high value to each of you in the next few months as you battle the COVID virus and you deal with the disparities in healthcare and in leadership that COVID has exposed, and work diligently to bring economic and financial stability to healthcare and to our country. Obviously, if you have any further questions, don't hesitate to reach out to us. Our contact information is there, and I'm sure I speak for the physicians on the panel and thanking you as attendees for the thoughts and perspectives and questions that you've asked. In closing, I'd invite you, all of you, to join us in discussions throughout the coming months in social media, LinkedIn, YouTube, and Twitter. But most importantly, subscribe to the newsletter, which comes out every 2 or 3 weeks, and we'll go to the website to hcg.org, and we'll see that we keep this dialogue going. And finally, a special thanks to our 6 technology partners in healthcare. HCG's business model is a very limited number of annual relationships with key innovation companies. And we do want to thank Change Healthcare and Zealous and SureScripts and Softeon, Sapari, and our newest sponsor, Hinge Healthcare, in the musculoskeletal area for keeping HCG going forward. We would not be able to have the impact that we've had over the years on healthcare without these relationships, and we greatly appreciate them. So thanks to all of you for your time and participation today in this live and interactive Q&A. And stay safe and be well and have a good day and a good fall and winter as we work through the crisis of COVID. Thank you.
Thank you.
Thank you.
Thanks.
Appreciate it.